Hello, welcome. Hello to everybody watching in the Clinical Connections Mentoring Facebook group. Hello if you're watching on Instagram, or hello if you're watching on YouTube. Thank you for being here. So, today I want to answer the question, have we made rehab too complex? Okay. To me, the short answer is absolutely. Some might agree with that, and that is totally okay. But I work with a lot of students and a lot of newer clinicians, and it's something that just kind of keeps coming up. I'll ask a student a question, and the answer becomes this lengthy, detailed dissertation when all I wanted was just a simple answer. Or I'll ask a student for an example of an exercise to strengthen the quads, and they'll appear stumped kind of at first, and then I can start to see those gears turning as they're trying to come up with this spectacular, mind-blowing exercise that's never been done before, when all I was looking for was just a different variation to a squat. Okay. Or I'll simply be scrolling through social media and read a post that's meant to be helpful, but it's full of nothing but medical jargon. And my all-time favorite thing that I keep seeing is if I'm scrolling through social media and I'll see an exercise designed to challenge like The Rock with a caption like, try this with your next patient with shoulder pain. So yeah, I think we have made rehab too complex, but let's talk about how we got here and what we can do about it. For anybody new watching, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that you can think of that there is for PTs, outpatient, home health, acute care, oncology. Most of my career was skilled nursing. I was a rehab director at a skilled nursing facility. I've done pediatrics. And I'm also done adjunct teaching, lab assisting, and now I'm the owner of a cash-based practice in Florida where I work mostly with gymnasts, cheerleaders, dancers, and I'm also the owner of Clinical Connections Mentoring, which is where you are right now. So what I'd like to do before we get started diving into all the details, if you're watching live, please type live in the comments. I'd like to know who you are. Tell me where you're from. Same thing if you're watching the replay, just drop replay. Tell me who you are, where you're from. I just like to know who I'm talking to. So let's start with why this is happening. I think it comes from a few different reasons. The first one I think comes from our desire to prove our value. And I think this really took off when we moved to the doctorate degree. Now, don't get me wrong here. I am proud of my doctorate degree. I don't really have a problem with the profession moving that way, but I think the path we took to get there wasn't great because it resulted in some unnecessary consequences like increased tuition, which is a huge problem, and a poor return on investment. But again, hindsight is 2020. What's done is done. We can't really change the past, but we can look forward. Okay. I think when we switched the doctorate degree, we felt like we needed to up our game and show our intelligence to the medical world. Excuse me. Um, and this meant adding a lot of excess fat to PT curriculums or OT curriculums as a way to teach students more information because we're going to be doctors now. So we needed to know more. Um, so curriculums started to just kind of add in a bunch of stuff. Some of it was necessary, some of it was not so necessary, which led to this challenge for faculty members and programs of this question of what is need to know versus what is nice to know. And for some programs, this led down this road of teaching students such detail about things that aren't necessarily needed for PTs and OTs to be able to effectively treat patients. All of this because, as a profession, we wanted to show our value to other healthcare providers because we were now a doctoring profession. Okay. But also, this need to prove our value doesn't just show up in PT and OT programs like as a whole. It's not just our profession as a whole. It also shows up in individual clinicians as well, especially those clinicians with imposter syndrome. These clinicians often feel the need to show their value or their worth to their patients, to their coworkers, to their bosses. And the result is this overcomplicating of simple tasks that can sometimes present itself as kind of showing off to other people, like explaining things to a patient by using all these medical terms just to sound smart, or prescribing these really complicated and complex exercises just so we can look creative to our coworkers, right? Another reason I think this is happening is because of the misconception that complex equals better. We think that a flashy, complicated exercise must be more effective than a simple foundational one. Doing a longer quad with a TheraBand is way too simple. If we really want to strengthen the quads, we need to make it weight bearing with more load while also dual tasking. But sometimes that's just too much. Both of these examples can be perfect interventions for one single patient. The power comes from knowing which exercise to use and when. But just because an exercise looks and feels more complicated does not mean that it's a better exercise. And to be honest, I think this actually starts in school. Okay. Professors try to challenge students to think deeper, which is really good. But sometimes I think that becomes this learned belief from students that deeper means more complicated. But thinking deeper actually means thinking more of why, not what. So if you're a student and you hear your professor say, think deeper, they want you to understand and think more of the why, not necessarily make it harder or more complicated. Okay. The third reason I think that this is happening is because of just information overload. We have access to so much information that it can be very overwhelming. We have research articles. We've got a billion techniques to choose from. We've got a billion influencers to follow on a billion social media outlets. And we feel the need to use every single one of them. And if we aren't looking at all the information, then we might miss something. And if we miss something, then we aren't helping our patients in the best possible way. So we just keep digging and digging and digging and trying to learn more things, which always complicates things. Okay, so now let's talk about why these things can be bad. Let's talk about the consequences. So, first, if we make rehab too complex, this is going to lead to patient confusion and disengagement. So, if you're educating a patient about their diagnosis and you're using all these medical terms, all this medical jargon, they're going to get overwhelmed and definitely get lost, especially if you don't slow down and explain things on their level. Communication is huge for patient buy in. So, if you're explaining something to a patient using all the medical terms you know, sounding like Grey's Anatomy, just so you can look smart, you're going to lose the patient. When patients are overwhelmed, they lose confidence in themselves and they lose confidence in the plan. Your job is to teach them so that they understand. Your job is to understand them and what they want. Patients care more about being able to understand their own problems than they care about how smart you sound. Okay. More patients will feel heard and understood when you speak to them equally. When you do this, the patient is going to be much more likely to buy into your plan of care. Okay. So if you're trying to impress the patient by sounding smart, you're more likely going to confuse that patient, which is going to lead to them being disengaged in your plan and anything you tell them. Okay. The second consequence, and it's a very big and a very popular one, is clinician burnout. So if you're spending all of your energy trying to create complex exercises, you're going to burn out. If you're spending all your time scrolling social media for new exercise ideas, you're going to burn out. If you're spending all your free weekends learning new techniques, going to CEU courses, getting obscure certifications, you're going to burn out. You're going to run out of time, right? Trying to look smart and superior by creating elaborate, complicated plans for every patient is just exhausting. Remember, information overload just makes things more complicated. And just because something looks complex or challenging doesn't mean that it is actually better. Simple can be a good thing, and simple can keep you free from burnout. Third consequence is that when we focus on making things more complex, we end up disconnecting ourselves from foundational principles. So we start to prioritize these flashy things over the basic things, and we forget that sometimes simple is enough. Remember, the basics are those foundational building blocks for everything for rehab. Sometimes that is where all the bread and butter is in those foundational skills. So if you're focusing too much on impressing your coworkers or your boss by creating these complex interventions, you are losing the focus. You've lost the point of rehab. The point is to help the patient reach their goals, and sometimes the best way to do that is with simplicity. Okay, a sit to stand holding a weight can strengthen the glutes and the quads just as well as a back squat with a barbell while standing on a BOSU. Okay, remember, Going back to the basics will serve your patients far better than this flashy, complex exercise that you can come up with. Now let's talk about the solution. What are we going to do about rehab becoming too complex? So we can start with remembering that we don't need to reinvent the wheel for every patient. Our goal isn't to create the most complex, impressive looking exercises. Our goal is to empower the patient. And often the simplest, most direct path is the most effective. Think about clarity over complexity. So we learned this in semester 1 of grad school. Use simple language, avoid medical jargon, use simple terms. How would you explain it to a fifth grader? Think about that and use those words. Explain the situation, explain the diagnosis, the plan, the why in a way that the patient can understand and connect with. It has to make sense to them. And if you want them to buy in and do the work you suggest, it's got to make sense to them. If they feel inferior to you because you're talking up here on this level, but they're following you down here on this level, they won't buy in and they won't respond. Okay, remember, be simple and clear. Next, think about connection over jargon. Build a relationship with the patient based on trust and understanding, not just your expertise. I know you're an expert, you know you're an expert, but it's more important to build that relationship on trust. I've talked about this a lot in many of my other videos, but you have to connect with the patient. If you use too much jargon, they are going to feel inferior to you and they will not trust you. Okay? Connect with the patient by listening to them, understanding them, and learning from them. That's what they want. They want to be heard and they want you to listen to them, learn from them. Okay. They don't necessarily care about how much you know, but they do care about how you make them feel. Okay. And if they feel heard, they're going to believe and think that you understand how they feel. Okay. Think about function over flash. So prioritize exercises that directly translate to the patient's goals, like getting up from a chair, walking without pain, reaching for something in a shelf overhead. This is easy for lower level patients to focus on that functional task. But even do that for those higher functioning patients like your adolescents and your athletes and your middle-aged go-getters. Just remember the KISS principle, right? Keep it simple. It does not have to be so complicated. Deadlifts, squats, hinges, overhead presses. These can be challenging and functional enough for a lot of your patients. You don't have to add extra flair by having them do those things on a Bosu with one eyed closed while saying the alphabet backwards. Keep it simple, okay? And last, remember to go back to the basics. Remember your foundational principles like exercise prescription, some your biomechanics, developmental positions and movement patterns, and functional movements. Yeah, these sound boring and they're far from sexy. I get it. But oftentimes these basics get the job done. Think about the what. What does the patient actually need from me right now? And think about the why. Why are you choosing this exercise? Why will the patient benefit from this intervention? Why is this going to help them? So, yeah, we have made rehab too complex. And the complexity stems from trying way too hard to show our value. It stems from clinicians' battles with imposter syndrome, trying to impress others, information overload, and that misconception that more is better. I see it in students who are trying to force every patient into a diagnosis because their school taught them a way of thinking that is far too complex than necessary. If you're a student, instead try thinking of this: simply treat the impairments. Okay. It is too complicated to try to fit every single patient into a specific diagnosis and a specific intervention bucket. Just treat the impairments that you find. It will be much simpler for you. Okay. I see it in new clinicians who are trying to create the perfect plan of care by making the most complex interventions because they want to impress way too many people. If you are a clinician, instead, I want you to think of this: simply treat what the patient needs right now and in a way that they can be successful. And I see it in our profession, who is trying to stand out among so many other healthcare providers just to prove our worth. For our profession, we are not brain surgeons. Most of what we do is not a life or death situation. We can still provide simple and effective treatment interventions. And when we can do this, our patients will get better, and that is what will prove our worth as a profession. Rehab doesn't have to be complicated for it to be effective. In fact, a lot of the time, its power lies in its simplicity. It can be easy, and it can be easy and effective. And trust me when I say, if you can accept this, return to the simple, avoid the complex, you may also find yourself feeling less overwhelmed and less stressed out. I hope you learned something new today. Please go ahead and drop in your comments your aha moment or something that really stood out for you or something new that you learned. I want to thank you for watching, whether you are watching on Instagram or if you are watching in the Facebook group. If you have any questions about what I talked about today, please feel free to reach out. Send me a message, drop your question in the comments, whichever. I would love to talk to you. I will see you next time.